Hello everyone, I'm Dr. Fathi Azribi, Consultant Medical Oncologist, American Hospital, Dubai, reporting from ESMO, Berlin on behalf of the Emirates Oncology Society. I would like to share the exciting highlights from the latest CDK4/6 inhibitors in the adjuvant setting in early stage hormone receptor positive, HER2 negative breast cancer. Now we have the long-term outcome data, and as we know, in this group of patients, hormone receptor positive, HER2 negative, the long-term outcome does matter. And now let us start with NATALEE. We have the 5-year NATALEE data, continues to redefine what's possible. After 5 years of follow-up, the invasive disease-free survival curves continue to separate, even 2 years after stopping ribociclib, with a stable hazard ratio of 0.716, which means 28% relative risk reduction and an absolute benefit of 4.5%. More importantly, ribociclib continues to prevent metastatic recurrence, with a distant recurrence-free survival hazard ratio of 0.7, showing a 30% reduction in metastatic risk and an absolute benefit of 4%. Across broader patient population, results remain consistent across all subgroups. In the high-risk node-negative subgroup, the upper limit of the confidence interval is now below 1, with a hazard ratio of 0.6. This is very reassuring and very interesting to know, and it reflects a 40% relative risk reduction and an absolute benefit of 5.7%. As overall survival continues to mature, there is a clear trend, 20% relative reduction in the risk of death, with an absolute difference of 1.6%. It's still not statistically significant. Now I will move to the second trial, MONARCH-E, and here we have 7-year follow-up data. It actually continued to set a new benchmark in adjuvant therapy. Now we have the overall survival is positive with a hazard ratio of 0.842, reflecting a 15.8% relative risk reduction in death and an absolute difference of 1.8%. The invasive disease-free survival, which was presented before, curves remain clearly separated with a hazard ratio of 0.734, which means 26% relative risk reduction and absolute benefit of 6.5%. Similarly, the distant disease-free survival curves remain separated with a hazard ratio of 0.746, representing a 25% relative risk reduction and an absolute difference of 5.1%. In conclusion, NATALEE and MONARCH-E trials continue to deliver long-term data that reinforces confidence and strengthens the evidence that both ribociclib and Abema are important drugs and adding value and improving the outcome for patients with early breast cancer. Thank you.